Hello everyone. Today we will discuss about core pulmonale, and I will tell you about core pulmonale by the help of a case in Agra. Okay, so let me tell you about what is core pulmonale. Core means cardia or heart, cardia or heart, and pulmonale refers to lungs. So whenever there is any disease that develops or origin or develop from lungs, and gradually and eventually it affects the heart, is known as core pulmonale. So now let me tell you about the case. A patient came to the hospital and he was about 73 years old. His age was 73 years old, 73, male patient, and he presented some symptoms. And the first symptom he told me about, that he is having chest pain in chest, that we also call as uh, angina, and he's having breathlessness. And after breathlessness he told me that he is having uh, tightness in chest and anxiety. Then he told me that he is having a cough with profuse expectoration, white white colored expectoration. And after this he narrate one more his symptom, and that is pain in all of his limbs, all limbs, both upper and both lower limbs. And on examination of his limbs, I find out that the patient is having edema, and the edema was pitting type of edema. Then after all these symptoms, he also told me that he is having heaviness in his hypochondriac region of the abdomen, heaviness in the hypochondriac region of abdomen, hypochondriac region. So with all these symptoms, chest pain, breathlessness, tightness in chest, anxiety, cough with profuse expectoration was of white color, pain in all the limbs, and heaviness in hypochondriac region. With all these symptoms, the patient presented to me. Then, after listening to all his symptoms, I asked him about his physical generals and his personal history. His physical generals, I found two peculiar physical generals in him, and they were he was having craving for red chili, and his water intake was very less water intake. And I also asked him about his personal history, and he told me that he was a chronic and a chain smoker for 59 years. And as he is now 79 years, and from the age of 14, he started smoking. So since 54, since 2 to 3 months only, since 2 to 3 months, he has left smoking. Okay, so this was his physical generals, and this was his past history. Physical generals and past history. Uh, okay, now after listening to his past history, I advised him to go for some investigations. The first investigation I advised him was ECG. In ECG, I find out that he is having inverted T wave. Inverted T wave is always suggestive of myocardial infarction. Uh, okay, now after listening to his past history, I advised him to go for some investigations. The first investigation I advised him was ECG. In ECG, I find out that he is having inverted T wave. Inverted T wave is always suggestive of myocardial infarction, means heart attack. And due to this inverted T wave, the patient was having these kind of symptoms. These symptoms, I should use another color. These symptoms: pain in chest, breathlessness, tightness in chest, and anxiety. So these four are the classical symptoms of myocardial infarction. Classical symptoms of myocardial infarction. Now, next one more finding I got from his ECG, uh, and that finding was his elevated ST segment. This elevated ST segment, it suggests that the patient is having decreased potassium in his body. Decreased potassium in his body. Then after ECG, I asked him to go for chest X-ray. And in chest X-ray, I find out some peculiar findings. And the first one is hyperinflation of lungs. And the second one is flattened diaphragm. So, findings we get in cases of COPD. So COPD. So now this complete case, it reveals that the patient, because of chronic smoking for about 59 years, the patient developed COPD. and due to COPD, he got myocardial infarction. Okay, and I will explain you in the pathophysiology of core pulmonale that why all these symptoms are happening. Now, after chest X-ray, I asked him to go for um, USG, USG of abdomen, because the patient is having the symptom of heaviness in the hypochondriac region. And in USG of abdomen, his liver was enlarged liver. He was having enlarged liver. So why all these symptoms are happening to the patient if the patient is having COPD? He developed COPD, and due to COPD, all these symptoms started. The symptoms of myocardial infarction and the symptoms of enlarged liver. What happens is that assume that these are lungs of the body. These are the lungs of the body, and this is the heart. I have made the heart bigger than the lungs, but never mind. So this uh, is the heart of the body, and these two are the lungs, and this is and these two are the lungs, and this is the left ventricle. This is right ventricle. This is left atrium, and this is right atrium. So we all know that from the uh, right ventricle, pulmonary artery, it takes the blood to the lungs. Okay, and as the patient is a chronic smoker, so he has developed COPD, and because of development of COPD, his lungs are not properly working. His lungs are not able to receive are not properly working. His lungs are not able to receive or accept the blood which is coming from right ventricle by the help of pulmonary artery. So the lungs are not able to receive or accept blood from the heart because the patient has developed COPD because of COPD, and because of which now due to which the patient now his lungs will create a backflow of blood to the heart. Now the blood will come to the heart, to the right ventricle of the heart, and from the right ventricle, the blood will go back to the right atrium. And from the right atrium, the blood will go to the inferior vena cava, go back to the inferior vena cava, and from the inferior vena cava, the blood will go back to the portal vein. I should use some other color for portal vein. This is portal vein. The blood will go back to the portal vein, and from the portal vein now the blood will go back to the uh, liver. So this is the liver. Now the blood is going back to the liver, and from the liver the patient and from the liver the blood will go to all the limbs, to both the upper limbs and both to the lower limbs. Now the blood will get accumulate in all the limbs. So when the blood will get accumulate in the limbs, so the patient will have edema in the limbs, and he will have pain. in his limbs because his limbs are not getting enough oxygenated blood from the heart. So that is why he is having edema and pain in his limbs. And as the blood is coming back from inferior vena cava to the liver by the help of portal vein, so there is liver enlargement is seen. So the disease. So this is core pulmonale, as the disease started from the lungs, that is COPD. Disease started or originated from the lungs, but the heart is also getting affected. The right ventricle is getting affected. So this is known as core pulmonale. And as the right ventricle, as there is backflow of blood from lungs to the right ventricle, now the right ventricle will develop hypertrophy. And this hypertrophy of right ventricle is creating myocardial infarction. Okay, so this is the case of the patient. So this was the case of the patient. The patient, actually the patient is of COPD, but core pulmonale is the complication of COPD. If the intensity of the COPD grows higher, then the patient can develop core pulmonale. And as the right ventricle, as there is backflow of blood from lungs to the right ventricle, now the right ventricle will develop hypertrophy. And this hypertrophy of right ventricle is creating myocardial infarction. Okay, so this is the case of the patient. So this was the case of the patient. The patient, actually the patient is of COPD, but core pulmonale is the complication of COPD. If the intensity of the COPD grows higher, then the patient can develop core pulmonale. So this is the reason why the patient is having myocardial infarction, symptoms of MI, and all the symptoms uh, like heaviness in the hypochondriac region and edema and cough. Cough was because of COPD. Okay, and pain in the limbs and heaviness in the hypochondriac region. These symptoms were because of a backflow of blood from lungs to the heart, as the blood is getting accumulated in the limbs. So these symptoms were occurring. So I hope now you got the complete picture of core pulmonale. If you have any question, then you can uh, ask me in the comment section. Uh, so this was the case of the patient, and in this kind of cases, we can prescribe homeopathic remedies like uh, tabacum and cratagus. So these kind of remedies we can prescribe the patient, and the patient will um, get better by these two remedies. So thank you so much. This was the case of core pulmonale. Thank you.